I am again. This is Dr. España, and today we have an amazing guest, Sean Ferguson, who's going to talk with us about speech therapy and different things of when we should worry or not. And so thank you so much for coming.
Well, thank you for inviting me.
One thing that I wanted to ask first is, I guess the first question everybody has is, when would you start worrying? Like what age? I get that question, all the time. And obviously as pediatricians, we go through development and I'm able to sort of talk to the parents a little bit to see when they need to worry or not. But when would you say as a speech therapist that you should start worrying and should seek some advice if you're worried that your child might not be developing correctly as far as their speech is concerned?
Absolutely. So we work with kids of all ages, and one of the big things we do is speech delay, right? And that's the general term for kids who are, as parents or pediatricians sometimes say late talkers. So often a child will show up, 18 months, and the parents are saying, hey, little Johnny's only saying a few words, or only has 1 or 2 or 3 words. And so, a lot of the calls we get are that early. Again, I don't often tell parents it's time to worry, but I guess we don't want you to worry. If you need to call us, we're here to help. Or if you need to call any speech pathologist, their speech pathologist can help. But around 18 months or 2 years is really the time we start really looking at, hey, how is language developing? At 1 year, of course, we want to start hearing our first words. At 18 months, kids should start really be starting to maybe putting together a few combinations, and at 2 years, we'd love to be hearing those combinations of 2 words and even up to 3-word phrases. So if we're not hearing the phrases at that time, that's a great time to call us. There's ample evidence that shows that speech and language is skewed, early education is skewed hard towards speech and language. And so helping your child be successful in speech and language will start them off for a really successful career in academia or in education, so that they can have a fantastic jump start on life.
Okay, good. So I guess 18 months to 2. So you would say that usually for speech delay you start around 2 as far as doing any type of therapy? I've
started as young as 6 months for kids that weren't. I work also with kids with swallowing disorders, so there's children that have difficulty. But even one of the kids I worked with that was 6 months had some feeding aversion, but also had issues with attachment, wasn't looking, and actually there's a few like this that wasn't really looking at caregivers, was extraordinarily fussy, and so we worked on some activities to help promote attachment with the parents, to help begin to build rapport. A lot of what we're looking at with early language, early pre-verbal language is things like gestures, things like eye gaze. Are they looking at mom's face? Are they able to do joint attention? Which is a huge thing. But 18 months to 2 years. The other thing is at that age we're relying a lot on the concept of neuroplasticity. So kids' brains are super malleable and they're able to learn anything. I tell parents that. So the earlier you start, if you do have concerns, generally the more rapid the child's able to make progress. And there's language disorder, which is more of an ongoing thing, right? Some children with speech delay don't always present with language disorder, and what that means is later in their life they may start to really pick up language quickly. But kids who do have that language disorder, again, the earlier, really in either case, in my opinion, I'm a huge proponent of early intervention. The earlier you start, the better off you are, but the kids with language disorder may have trouble throughout their lives. And there's really no way to tell if the child's going to be speech delayed or speech disordered. Again, I think it's wise to at least get an evaluation, seek professionals' guidance and do some therapy if it looks like the child's delayed in some way.
Okay, perfect. Yeah. So first, obviously, talk to your pediatrician as always, because definitely we're the first people and the ones that are seeing them at 2, at 4, at 6 months, all the checkups. And then if we feel like they really are truly delayed, then we have amazing people like Sean that could do an evaluation and go from there. So talk to me a little bit about this swallowing issue too,
Sure.
Because a lot of people think speech and they immediately just think of words and talking, but they don't ever kind of think of that, that speech therapists talk, working about swallowing and things like that. Of course, too.
Yeah. And so, just to kind of give an overview, general lay of the land, what we do is we work with children with speech delay, we work with children with developmental delays and disorders like autism, like Down syndrome, like things like that are going to be more of a ongoing need for therapy, probably for a longer period of time. We also work with kids with social skills problems, And that can manifest as kids get older and they have difficulty taking perspective and thinking, what's my friend thinking? They're kind of only thinking about themselves. And then the other bucket, of course, is what you just asked about, which is dysphagia, swallowing disorders. And with swallowing disorders, how we typically treat that is I always like to start with a modified barium swallow study. That's something the hospital will do. We can't do that. So we'd send you to a local hospital or refer out and let you know, what they do is they'll have your child eat a cookie and drink some milk or water with some barium mixed in, which is a safe thing for them to drink, but allows them to see on a radiograph how the swallow's going and where the food's going. That way we can determine if the child's actually choking,
right.
If it's going into their lungs, which is called aspiration, that's a big risk. If the child, there's a lot of factors that play into that, and I'm not going to go into all that. But then essentially, once we have that picture of what's going on, we can start to begin a diet modification and compensatory strategy plan, which could involve a chin tuck, it could involve a head turn, it certainly will probably involve thickening, and there's a lot of safe ways to thicken. For babies, I've used infant oatmeal, which is not the chunky oatmeal we're used to, but it's powdered oatmeal, and you can mix that in, because and for kids with allergies, there's other options as well. So
yeah, good to know. So I wanted to bring that up, and it's very important that you bring it up to your pediatrician as well. If you feel like your child is choking more than normal, even with just regular, when they're drinking formula or when they're breastfeeding, sometimes that can be a problem, like you said, if it goes into the lungs. And so we always need to know that, since we don't always, the good thing is here at Concierge Pediatrics, we have time, and a lot of times I sit there and I breastfeed with the parents, and we have time to actually feed the child, but not every pediatrician has an hour for every checkup. And so if you feel like if they're doing it at home and your pediatrician has not necessarily watched your child feed, it's very important to bring that up. So some people might not think is that just because they might need a test like the barium swallow or an evaluation from a speech therapist. So I just wanted to bring that up because I think most people don't think about that that speech therapists go kind of hand in hand with swallowing. So I think it's kind of important. And
for your guys, for what you see, often kids who have difficulty with latching and with to swallow with breastfeeding, it is at times it's indicative that there may be something else going on. So it's a really good, it's absolutely consult your pediatrician if there's something going on, and talk to someone that's going to give you the time to really just look into the whole issue. For sure.
So now I want to talk a little bit more too. You said that you work as well with kids that have like maybe awkward social issues, because we might not think of speech therapists, doing those type of things. But I think it's really interesting, and you brought it to our attention in office recently that you guys are doing a program for kids kind of that have that. So talk to us a little bit more and explain what that program is, because some kid that might not necessarily have a speech delay definitely might benefit from what you guys are doing, which I think is great.
So our social groups start typically at late 3 or 4, and we try to pair kids that work well together. Our groups max out at 4 to 5, so we try to keep them small. But they're super structured, and actually I have a bunch of materials here to show you guys. But we built our program based on this concept of perspective taking, and so we use some materials from this company called Social Thinking. We also use materials from other companies, but I love this one, and they've got a whole series of books. So what we typically will do in the group is and we also do this in individual therapy, by the way, but in the group we'll sit and we'll read the book, we'll talk about the concepts in the book. So this first concept is thinking, thoughts, and feeling feelings. It means that I have feelings, I have thoughts, my thoughts are different from my feelings. Dr. España has thoughts and feelings, they're separate from mine. So the book kind of goes into some examples of how, how when we're playing together, we think about one another, and how, it introduces thought bubbles. It's lots of fun. Here we're talking about the feelings, and I love this part because Jesse gets so excited because he built this tower, and then later, he builds another tower with his friend Molly. Molly kicks it over. Jesse's not too happy about that. So this, again, perspective taking. Kids don't always understand. Some of the kids we work with are very impulsive, right? They just want to go and well, I'm gonna go do this thing. But then another kid's like, hey man, you bumped right into me, or you pushed me over, or something like that. So it helps kids to, and again, this is with the 4-year-old set, right? So we've got this whole series of books. With older kids, we're working more on like high level perspective taking. So we work on how to greet people. Like for a little one, we might teach them to say hi or hello. If we're working with a 9 or 10 or 11 or 12 or 14-year-old, they don't really say hi or hello. They say what's up, they might say sup, they're like hey. So we teach them these higher level skills because a lot of kids don't get that, and they can get ostracized. And my concern overall as a human, as a speech pathologist and as a human, is that our future is headed toward a place where we're gonna have kids who have, or excuse me, children who are gonna grow into adults who cannot competently communicate and hold a conversation and take perspective because they're all stuck in their iPads and things like that.
Absolutely, and I think everybody that has watched any video that I've made knows that that's kind of my huge pet peeve as far as, being on the iPad or stuck on your phone. I know I have an 11-year-old, and I just, to tell you the story that happened this weekend, one of our friends called me and she was very awkward, and because my daughter doesn't have a phone, so she calls my phone and says, hi, I really want to invite, your daughter to see if she can come have lunch with us. I said, sure. And I said, well, let me ask her and I'll call you back. And so then I called my daughter and said, why don't you call your friend? And so she's like, well, can I just text her? I said, no, you call her and talk to her. And it's amazing. I mean, I guess we don't realize it, but even the kids, they can be sitting right across from each other and they'd rather just be stuck and just text to each other. So you're right, they're not learning good communication skills. And they're on the phone and they seem so awkward. She's like, yes, my mom said, okay, bye. And then I said, well, are they gonna come pick you up? Are you gonna, important things that you need to find out, or am I taking you? Oh, hold on, call her back. Called her back. Are you gonna pick me up? Okay, bye. And I said, well, what time? They just get completely blocked, and it's really sad. So I agree. I think that obviously we have to learn how to communicate with each other, and this is one of the reasons why I think I love this program, because it's not just for kids that have speech delay, and obviously it's for some kids that are having some, maybe a little bit more, communication issues, but I think any of our kids, we can definitely start teaching them that ourselves at home, so they're able to communicate and they're not stuck on devices all day long.
And these are early skills that'll lead to strong relationships when they go to school, being able to make stronger friendships, eventually ace job interviews, get the job, eventually date, eventually maybe have a family. But these are all, they're higher level skills, and the thing is, we take them for granted. We don't think about how many of us develop them. Now again, texting is not going away anytime soon. So, people are gonna text, but the issue is knowing how to make that phone call, being able to, functionally do that. Being able to, I don't think the phone's gonna go away anytime soon either. So back to the program though, so we go through this book, and then we have games that are built around showing what it's like when we don't do the thing that's shown in the book. So some of the concepts are, body in the group, mind in the group, so we bring our mind to the group, whole body listening, we're doing that one today. And that's a lot of fun. So, we have our arms are listening. So if I'm just sitting here waving while Dr. España is talking, I might not be interrupting her, but I kind of am with my body language. It's very strange. So this is early, again, teaching body language, which, anyone who knows communication knows body language is so much more than, communication is so much more than verbal. It's a huge chunk of his body language.
Okay, so where are these programs? How often are they, and how can people kind of find out about them too?
Okay, well, they can find us, they can contact me through our website, which is lifeskillstherapy.com. You can always send us an email. It's contact@lifeskillstherapy.com. We're hosting right now at the Lovett Center, which is here in Houston at Montrose and Lovett. We're planning on opening a brick and mortar office probably in the next year or so, but for now we're hosting them there. It's a lovely facility. It used to be the old Joy School, if people are familiar with the Joy School, and they basically repurposed it as sort of a place where people can rent spaces for, to do therapy. So we use an upstairs classroom there, and it's really nice and a lot of fun.
And what commitment? Is it like a once a week class thing, or what type? Yeah, okay.
They are once a week. So the kids, and you mentioned communication versus language. Most of the kids in the class have pretty high language skills. They may have some speech issues. Maybe we're working on our L sound, our S sound, our R sound. But overall, our language is good. We're able to construct sentences. The challenge is, again, the pragmatic communication, the ability to interpret what another person's thinking and fit in with the group and do what kind of the group is doing. It's generally, we'd like people to show up and commit for at least the semester, but it is once a week. And again, we have it for all ages. So that's the 4 to 5 year olds. The older kids, the plans are different. So there's,
And you go all the way up to what age?
well, we would, honestly, I've worked with adults on this stuff, so, we can work with people.
We
of
all
all
know
ages.
some adults that
Yeah,
probably
there are adults,
definitely need some communication
We're
problems.
pediatric focused though. I mean, our
Yeah.
groups are pediatric focused. With the adults, it's more individual therapy. It's more one-on-one. It's kind of figuring out, again, strategies for being able to make a new friend, especially for people who move to a new city and may have those weaker social skills. We're a good resource for you to be able to talk to.
No, great. I really like that program, and I hadn't heard of many people that are doing that program, so that's why I wanted to bring it up today. Now, lastly, to show us, because I know you brought some props and some toys. You guys can't see it, so we got to sort of leave it
It's
up.
a lovely farm.
Yeah, so if you can show us some props too, because I know that how I met Sean, it's because he does, individual therapy at people's homes. And so I know that we have definitely sent some of our patients to him. He also speaks fluent Spanish. I wanted him, since he brought all these props, to kind of show like, what does speech therapy, like if you go to someone's house, what are you gonna be doing with the kids? Like how do you teach a 2-year-old, any kind of speech therapy type of thing. People are always asking me that, so I think it's great that you brought some props here.
So speech therapy is fun. So it's not just me actually. We've got a small business and we're growing. We're called Life Skills Therapy, and as Dr. España said, we go to your home. So we're a concierge service, kind of like they are, where we spend the time with you. We're very focused on caregiver training. We're very focused on teaching you guys how to teach your kids. But for the initial evaluation, we show up at your home. We'll have a conversation about your child. We'll do an evaluation. I'll bring some bubbles, stickers, and some toys to kind of, begin to build rapport, which is kind of the idea that we have a relationship with one another.
Mm-hmm.
And then again, the therapy just happens right there in the living room, 9 times out of 10. Mom's right there, the nanny's right there, dad's right there, whoever is available. We always need to have a parent there so that we can teach them.
That's a way to say. So it's really important too.
Oh,
It's not you going in, but we're teaching the parents, or he's teaching the parents and their caregivers, so you guys can. This is an ongoing thing.
Exactly, it's an ongoing thing, and it's a lot of fun and it works. So we bring, as she said, we've got a bunch of farm animals. So I'll bring the farm, and I've got a kid. One of the kids, when I show up, he always goes ding ding because he's so excited about the farm. The ding ding, because it rings like a bell. But yeah, we'll play with the farm, and essentially we'll use this to work on early verbs like the daddy's driving the tractor, drive tractor. A lot of what we start with a child that's speech delayed is building vocabulary. So we'll start with things that they're interested in, like chicken. We got the daddy chicken, we got the mommy chicken. That's a good pair. We got our horse. So we keep all our toys together and just have a lot of fun with that. I bring cars, toy food things. So again, teaching things like cut, so we can cut, we can cook. We can pretend to make food. We play with blocks. We can make things fall down. Essentially, it's kind of like I try to find what the child's interest is and go in that direction, so that I can allow them to lead us into therapy. Because again, whatever they're interested in is what they're going to want to talk about. That's how we are, right? We want to talk about what we're interested in.
Mm-hmm.
So we find things that interest the child, begin to build therapy sessions around that, and then language tends to blossom. It's really a lot of fun to see a child start to say her first words or phrases. It's amazing. I had a child the other day who said, I said, here you go, and she goes, here you go. She said it like right back to me, like just like that. And mom's like, I see that all the time. And in that same session, she said mama for this first time. And so mom was really happy about that. Dad's like, when's dad out? I want to hear dad out.
At some point. No, I'm just kidding.
At some point, usually we hear that too. Yeah. But yeah, it's a lot of fun. What else? I brought a few other things. One other one is we play games too. So for the older ones, as kids get older, we'll start to play with games that are more like take turns and things like that. And this is a lot of fun, where we're able to pick an animal. So a lot of the kids like the dinosaur, so you choose the dinosaur, and then we've got this bag of coins, I call them, and this magic wand, so they stick. So it's just like early magnet concepts. That's a lot of fun. So we're putting the coins on, we're rolling the dice, and then we've got a bunch of cards in here to work on past tense, to work on what we did yesterday, what we already did, or to work on building longer sentences. So we're really big on helping kids speak in sentences, because that's how we talk.
Correct, that's great, and I love seeing this, because I know that when he first came and talked to us, that one of the things too is to say that, he makes it fun, and he gets down on the floor, and I know that that's a fact, because I know several of our patients have used him. And so he's down on the floor, playing with the kids, and so that the kids are gonna have fun, and if they're having fun while they're learning, so it's like definitely play therapy, then they're gonna, more likely learn a little bit better and be a little bit more into the therapy than if it's just like a classroom style with like a, dry erase board or whatever. You're probably gonna lose them in the first 5 minutes.
One of our mottos is when children are laughing, they're learning. So we try to make it as fun and interactive. I mean, we're pulling back the race car go, and the car's flying across the room, and they're laughing. Pop bubble. We got so many bubbles. So I mean, these are early phrases that I tend to repeat a lot, and that's the thing I tell parents too. Is just repetition builds language. Just like when you go to the gym, you got to do those reps to get stronger. It's the same thing with language. It builds these deep grooves of neurons, and it just allows the brain to continue to use that same path. So we're building those neural pathways.
This brings it right into my question.
Yes.
One of my last questions I was going to ask is if you were to give parents sort of an idea of what to do to stimulate, speech and also to watch to see how the kids are doing, what's advice that you would say? Maybe like top 2 or 3 things. I think you just mentioned repetition.
Absolutely, yeah, repetition, and I'm really big on reading books, so just finding books that the kids like. Now, parents often don't know how to read books, and I say that lovingly, right? So this is not a good example of a children's book I would read to a small child, but for a very small child, if I were talking about this, I might say, the boy has the car. That's it. Then we turn the page. Like, that's all we're talking about. Stories are lost on kids. I mean, often for very little children, stories are lost. So I'm really big on, just talk about, for brown bear, like that's a great one, brown bear, what do you see? But other books that don't have sing-songy things, you can just talk about the pictures. And I'm really big on that because, again, kids are gonna point and say, they're gonna say doggy, they're gonna say kitty as they start to develop language. So we're just gonna talk about what's in the book. So we did repetition, we did reading. And another one is just really spending the time to play with your child, find out what he or she likes, and just doing those things. If she really likes puppies, dogs, find a stuffed animal dog and think of all the things a dog does. You can feed the dog, you could put a little fake pretend leash on the dog, you could walk the dog. And so just, thinking about how to put these nouns and verbs together, right? Verbs are the action words, nouns are the things in our world that make our world. That's one of the big things we do is making it, kids who are speech delayed are often very active, right? And all kids are really, but they want to run around, they want to do stuff. So we make therapy very active, right? We're cutting the fruit, we're feeding the puppy, we're like jumping up and down. All these are like action words and they're a lot of fun. So making it, fun and interactive. And it can be tough at the end of the day, but if you can muster 10 minutes to do that or 15 minutes to do that, make a big difference if you can do that every day.
I love that. I agree with 1,000% of what you said, but yes, repetition, and I tell everybody that. Reading, as early as 6 months, believe it or not, which is when, the reason we pick 6 months is because whenever they can sort of sit down on your lap a little bit better than before that. And really just sort of passing the pages. You don't have to read word for word, and I agree with you. And then the third is playing with them. So no fancy app will ever, replace just some blocks.
True.
And you can just buy, blocks from IKEA that are the dollar store or something, nothing fancy, and your kid will learn so much more with interaction with you just building the blocks and put them on top than any kind of fancy app out there. So I'm not against completely technology. Obviously, technology's not going away.
We're using it now.
Yeah. But we need to just, learn to not use technology, especially at an early age, to replace interaction, with a parent or a brother or sister or anybody, any family member or caregiver. That definitely is the number one thing that I think is going to help them develop and be better little.
And the American Academy of Pediatrics, agrees with you 1,000% too regarding regarding reducing screen time. I mean, think about the first time, like if you've never built a block tower and you're 2 years old and you build this tower with mommy and then you push that thing over and it falls and it crashes, how funny is that? No app is ever going to simulate that. That's just not possible. Like the joy of gravity. Like this kid doesn't even understand gravity yet. It's like we take these things for granted, but children, there's so much to learn. And so, embracing the opportunities to teach them is a beautiful thing.
And we're all busy. I'm a busy working mama too, but we do need to, sit down and think, like you said, even just 10 minutes at the end of the day to just sit down, unwind and kind of play with them with everything makes a huge difference. So thanks again for coming to see us.
Thank you so much.
And we probably will hear some more from Sean later. And so I hope you guys have a great Thursday and a great weekend coming.
Yes.
And see you later. Bye.
Feel free to reach out with any questions too. Always available.